Hello everyone, good afternoon. Welcome to another episode with your fertility specialist. I hope you're all having a nice day. Thank you so much for tuning in and joining us. For those who are yet to join us, please do well to call up your friends, call up your family members, call up people that you care about to join us in this episode once again. So today we'll be talking about being pregnant through IVF and then what to expect next. And with us here today, we have with us our lovely Dr. Kenneth Egoda with us. Thank you, sir, for being with us here once again.
Pleasure.
All right, so let's just get right into it. We're so sorry for the delay, so we'll try not to take too much of your time. Okay, so we know a lot of people have misconceptions about IVF pregnancies being different from spontaneous pregnancies. So please tell us, is there any difference between getting pregnant through IVF or getting pregnant normally?
Yeah, thank you so much for having me on your show. And I hope we do justice to this time together. When you get to IVF, so many things. The only areas where they are different is the means by which fertilization happens. In IVF, for instance, fertilization happen in a dish in the laboratory, a special environment. A special controlled environment, and
Environment.
that's where fertilization happen. And as against the spontaneous pregnancy where fertilization happen in the
In the
uterus of
uterus.
a woman. So in IVF you are intentional about it. In the spontaneous pregnancy, well, you could be intentional about it, but you have no idea what's really going on. But it just happened. Nature takes charge of every event that happened there. And when pregnancy happened by IVF, there are some the way to go about it, because you've programmed the woman to ovulate. You collected her partner's sperms either by surgical retrieval of sperms or by ejaculation by any means and delivery to the lab where fertilization happens. But then the wife's eggs or oocytes are retrieved by a mini surgical procedure, and that process of retrieval can actually alter some things in the cavity wherein the eggs are collected. And that from and should have a hormone supply or hormone replacement or hormone therapy when she gets pregnant spontaneously. But in IVF, it's always the norm to have a supply of hormone medications, basically the estrogen and then the progesterone. So those are just the things to give them, and they'll be on it for a while before they are weaned off those medication. And thereafter, the pregnancy just goes the same with spontaneous pregnancy.
So even those that end up doing natural cycle IVF, they end up continuing with the hormone medications too.
You see, for natural cycle IVF, depending on how fanatical you intend to be about understanding or practice of natural cycle IVF, the medications are actually given.
Okay.
Yes, the same hormones are given for natural cycle IVF, and they're given to the point where where it is established that the placenta is established,
Okay.
and then the placenta and other players in the
In
in
maintaining pregnancy.
may take up the charge of production of the hormones that sustains pregnancy. And a conventional IVF
IVF.
are basically the same. The hormones are given at the same time, are given alongside in each of the treatments. So the dose of volume may be different, but the same drugs are used.
Okay. So, what are some of the expectations? What do you expect after you get pregnant with IVF? What are some expectations do you expect?
I don't understand you. Oocyte retrieval, the embryo transfer, and then to pregnancy test. A whole lot of monitoring, goes down, the treatment process, from monitoring to see whether the woman is well down regulated, whether her body is responding to medication,
Expectations.
whether the oocytes, eggs, follicles are growing as expected, monitoring the thickness of the lining of our womb to see whether they are thick enough for each of the processes or the phases of IVF till the point where pregnancy test is done. So I guess your question is from that pregnancy test. When
Yes.
pregnancy test is done, for instance, and beautiful, the woman is pregnant, there are quite a number of things that is expected of her. She's still expected to take life as simple as possible, but live a normal, regular life, sure. But then she'll need to be on some of these medications. The basic medications are the progesterone that can come in any form. Some of the medications are pessaries. Some of the progesterones are pessaries, and women can insert it through the vagina. And some other medications are tablets, like the estrogens, for instance. So they can be ingested by mouth. Then some are injections, like the progesterones, for instance, could be injections, and then they're injected in whichever part of the body has muscles. And yes, so some may take the human coronary gonadotropins, and then the function of this human coronary gonadotropin is to sustain the luteal cyst that produce progesterone, and also help in sustaining the pregnancy. So the women are expected to continue on this medication for a while. And now, traditionally, they're expected to be on this medication for about 12 weeks,
Okay.
even though from experts' analysis, it's observed that as early as 6 8 weeks, some of these medications can be tailed off, and the pregnancy sustains itself. But of course, you're just careful largely not to take a woman off medication that her body needs. And knowing that IVF pregnancies, can be very fragile and the early stage, you also don't want to take the woman off this medication too quick or too soon. So you don't have any need to blame the quick uh, weaning off
The
medication. So they're
medications.
supposed to be on this medication and all. I mean, through this period of 12 weeks to 13 weeks. And then intermittently, they may have reasons to visit the hospital for scan. Early scans done like 2 weeks after the pregnancy test. So you just see what the woman is carrying, whether it's a single and fetus she's carrying or multiple fetuses that she's carrying. So counseling and the style of treatment can differ from this perspective. So when you understand what the woman is carrying, you could individualize her follow-up and all of that. And of course, when they have other complaints related to pregnancy, which could be the side effects of the medications, sleepiness, vomiting, laziness, and just general feeling of unwell, you could treat her accordingly. Sometimes the vomiting could be very notorious, especially when these medications are not well tolerated by the individuals. They could have vomitings, and they should be treated as soon as you understand what's going on with them. So you see them 2 weekly or 3 weekly, depending on how convenient it is. And of course, for those who are not resident in the town where they are, they continue their care with their gynecologist or with their obstetrician wherever they live. So this is how to individualize their care and monitor them until they get out of the woods. and with IVF, usually it's about 12 weeks. Yeah.
Okay, because I know some do they also do blood tests to monitor the growth of the fetus, because sometimes some people say they want to do beta HCG to check whether the pregnancy is progressing or not, because sometimes your pregnancy test can be positive but it does not advance or grow
Yeah,
as
yeah,
expected.
yeah. The serum beta HCG, for instance, is a very important test to do. One, to confirm pregnancy, and to see the progression of the pregnancy. Yeah, there are some. It's not necessary for everyone. You
Okay.
know, gynecologists or obstetricians should have reasons why this would be done. If you have a pregnancy that you're not satisfied with the progression of the pregnancy, I mean early pregnancy, you're not seeing the signs you should see. You don't know whether the pregnancy is viable or not. Then you may want to do the beta serum beta
HCG.
HCG, that's human chorionic gonadotropin, to see whether it's increasing, because at every stage of pregnancy there is an incremental amount or quantity you expect, and so you could
Wow.
use to monitor the progression of the pregnancy. But if the pregnancy looks well by ultrasound scan, you have a fetus or fetuses that are having good cardiac activity, heart activity, the liquor around the baby is building normally, and all of that. You may not need to do that per visit. So you should do it when there is a good reason
Reason.
to do that. But of course, it's a very vital investigations to do. Also, when you're not sure that the pregnancy is viable, as against asking a woman, hey, let's see you in 2 weeks, let's see you in 3 weeks, you could just use the beta HCG to tell her directly, within 2 days, that this pregnancy is fine or this pregnancy is not
Not
fine.
fine.
In which case, you do the things that is necessary, and she understands what's really going on.
Okay.
So it's a very important test. But for those who are taking a beta HCG, for instance, as form of luteal support, now luteal support is all these medications that you give them after pregnancy test is positive. You have the regular luteal support, you have the advanced luteal support, and the choice for each of these depends on the peculiarity of the patient.
Okay.
So some people take beta HCG, human chorionic gonadotropin, as part of their luteal support. In this case, monitoring it, using it as an index of monitoring the progress of
Might
pregnancy,
not be
may not be very
accurate.
accurate, because she's already on it. It's already you're injecting it into the
It's,
system. So now you're monitoring whether or not,
it's growing
it's
or
growing,
not.
it's going on or not. So that's just what it takes. So, but then you give them all the medications they need and you monitor them accordingly. And the monitoring is individualized. No one monitoring system, it's applicable
To
to
all.
every person, because women, especially in this part of the world, they always compare notes. Hey, why did Ken give you this medication and he didn't give me? It probably means that Ken loves you more than me,
Mm,
or the doctor is
it's
biased,
favoritism.
or are you paying extra money for this? They compare all these notes, but they don't know the scientific reason or the obstetric reason why the doctor gives
A
one
certain
medication
meds
to
to
the
one.
other and a different medication to the next person.
And Nigerians, we like to compare notes.
Exactly.
Like to compare notes.
Exactly.
So I
Yeah.
hope we're all learning something, or I hope we're learning something, because I'm sure some people around us, we've had people that have gone through the IVF process and their pregnancy tests have come out positive. So if you have any of such people, please call them to join us. It's not too late for them to join us. So moving forward, we talked about people that have multiple pregnancies through IVF, which is a thing of joy considering the challenges that you may have gone through to get to that point. So, what are some of the risks associated with multiple pregnancies in IVF, causing through IVF?
Yes, why you mention a thing of joy, to some of us who are obstetricians, multiple pregnancy may not necessarily be a thing of joy. We could tolerate twin pregnancy, and I mean, we can tolerate twin pregnancy, but higher other multitudes, for instance, like triplet gestation, and
On the quads.
and the quadruplets gestation, and higher order multiples may not be very interesting, depending on the system you operate and who funds the bill. and how important to take the life and health of this woman who is pregnant. So what's the question again?
What? Oh my god, we are talking about the risk
The risks,
associated.
oh, plenty of risks, of course. The fact that it's multiple means everything associated with it is multiple. You know, if she's vomiting, she'll probably be vomiting multiple.
Multiple.
If you understand what that means. So she'll be having excessive vomiting. The signs of pregnancy, for instance, may be exaggerated. The weakness, the tiredness may just be exaggerated. And with multiple pregnancy, the chance of even losing all the pregnancies is high.
Oh well.
Yes, because it's high. The chance of losing all the pregnancy. So the symptoms and the side effects of the medications, in addition to the symptomatology of the pregnancy, seem to be exaggerated with multiple pregnancies. I just remember I just saw a woman some days ago, you with triplets, with triplet gestation. She was like, "Hey, Ken, how did I get this triplet? I don't know. I got triplet." We arrived at the number of embryos to transfer, and you got three, and then the three stayed, and nobody knew three was going to stay because actually it is a gamble. That's the truth. Nobody can tell with precision the number of embryos that could stay. So it's actually a big challenge to have triplets because when it gets to the second trimester of pregnancy, for instance, the physical load of the pregnancy, the physical weight of the pregnancy, and how it deals with the body of the woman, you know, is exaggerated. And then also the chance of delivering the baby is a little earlier than necessary, with a problem of prematurity in special care baby units, special care for babies. I mean, the NICU care, babies intensive care units, and all of that. And the cost associated with it to be maybe too high. So these are all the risks associated with it. The risks are the high risks of, I mean, it's operatory delivery anyways. Once you have higher order multiples, so you see you're having surgeries on top of deliveries, just for deliveries, and the complications of surgeries or the risks associated with surgeries and all of that. So a lot of people in Africa celebrate that. You understand? So we don't celebrate it much, but it's just what it is.
And there's no way to reduce the number of embryos after they've been transferred.
Yeah, they can be reduced actually. Yes, it can be reduced. It's a part of the practice that not so many people talk about. So we have what we call a fetal reduction, you know, fetal reduction procedure. And there are reasons why that can be done, because multiple pregnancy can actually be complicated and then can actually be very risky to the life of a woman. And when you weigh all the risks and individualize the person in question, knowing that this is somebody that cannot be able to tolerate a singleton pregnancy, and now the person has a three pregnancy. So you have to do what you need to do to make life bearable for
Easy.
everybody. Because the argument here will be leave it to chance. Well, as an individual, I don't like leaving things to chance. I like to be in charge. Yeah, I like to be in charge. So long as there is a good reason for doing what
Being in
I want to
charge.
do. So sometimes when you don't act, bad things happen. So but when you act, good things could just happen. But a superior way to look at it is that why do you even have to allow it to get to multiple pregnancies? Why don't you just stick to doing
Single
a single
transfer.
transfer or just two embryo transfer? That way, no matter how bad it gets, it's easy to manage. So that's the way a lot of countries operate. They just do single embryo transfer, but though the failure rate may be very high associated with single embryo transfer. But there are reasons for all of that. So the risks associated with multiple pregnancy could actually be high from the period of point of conception, first trimester, second trimester to delivery.
Especially,
Even the risks at operation is higher.
especially if you already have a pre-existing health condition.
Exactly. If If you have a pre-existing health condition, the diabetes, the hypertension,
Hypertension.
and some other things, then they are likely going to get worse, when you have multiple pregnancies. Single pregnancy is enough load if you have all these conditions, but now multiple pregnancy is an added load, an added complication.
So after pregnancy, after the pregnancy test has been positive, what lifestyle do we need to exercise? Do you need to eat healthy? What's the expected lifestyle?
Okay, now the lifestyle now is still individualized. The lifestyle is individualized. The goal here is to live as simple and healthy as possible. And then I say that the goal would be to live your regular life. If your life needs to be regimented, it should be regimented based on the clinical or obstetric reasons. You know, so if you need to have a regimented life, it should be clinical or obstetric reasons. Otherwise, there is no need to regiment an individual's life. It's just like any other pregnancy. So I see no difference between the IVF pregnancy and the spontaneous pregnancy. It's just the same lifestyle. But in this part of the world, for instance, when people get pregnant by IVF, it is being idolized, and you become like a golden egg that shouldn't be really toyed with. But I think it's the same with every other pregnancy, and so you should live normally. Live normally, and the same advice you give to those who conceive spontaneously should be the same advice given to those who conceive by IVF.
IVF.
The difference may just be in the first 3 months where they are under strict care and medications, the luteal support medications, because of spontaneous pregnancy. Now, you may want to ask me whether they should have sex or no sex. Tell me the truth. Don't you intend asking me this question?
That was going to be my next question.
I know, because many times we get this call. Hey, doc, should I
And I meet my
meet my
wife.
wife? Sometimes I don't know what the meanings of all of those questions are. But you see, sometimes you have early pregnancies that are not yet established. So it's good to stay away from intercourse, sexual intercourse, for instance, because sometimes these IVF candidates spots. They have Sometimes they have spottings early in pregnancy, and then if you have intercourse and have orgasm, for instance, during orgasm there is a heightened contraction of the uterus itself, and then you have a primitive
Embryo.
embryos trying to get established, and you're adding contractions upon the period of this primitive stage
Implantation.
implantation. Then of course the bleeding may just be encouraged, and then you could have problems at that point, you know but you could also have sex and not have anything. But chances are that if you have orgasm, there's likely going to be pelvic contraction, uterine contraction, some trauma to the cervix, and all of that, depending on the kind of sex, anyway. But then we tend to discourage it at that point in time. You know, when pregnancy is fully, yeah, and go down. So I think restriction is also the restriction. Every candidate should learn to understand the reasons and take rest. I think I'll have to say about intercourse. Yeah, but if you get advanced and even spontaneous pregnancy, for instance, if you have a if you have a early pregnancy challenges, for instance, you got pregnant spontaneously and then you have spotting or bleeding. I mean, within the first 1-2 months of pregnancy, intercourse will also cause problems.
Okay.
Yes, and at that point, the obstetrician will actually want to advise you to stay away from intercourse. So there's no big deal about that. Stay away and get healthy and get well and get established with the pregnancy. Then, of course, and
You can wait 3 months.
yeah. So that's the way it is. So all of these instructions are individualized. It is not a blanket instructions. You give them based on the physiological condition or the obstetric condition at that point in time. That's what I think. Uh-huh.
So as we're rounding up, a lot of people they have this anxiety about IVF pregnancies. What's your advice? Well, let's say what's your advice to them?
How do you mean anxiety about IVF
A lot of
pregnancy?
people have anxiety about IVF. Maybe if the pregnancy comes, okay, will it fail? I've tried before, that's failed before. Especially for those that have had multiple failed IVF pregnancies.
Yes, if they have the anxiety, it's good to discuss with the doctor. What the anxieties are, or with the team monitoring them. If you understand what happens with spontaneous pregnancy, you will not have so much anxiety with IVF, because you see, with the rate of success, the fecundity rate for spontaneous pregnancy is about 20 to 25% per month.
Oh, wow.
Yes, but for IVF, pregnancy rate, of the population per month is about 32%. So chances that IVF will succeed is higher than spontaneous pregnancy succeeding. But because people do not attach this level of importance to spontaneous pregnancy, it doesn't pain them when it doesn't work. How do I mean? Most spontaneous pregnancy, most times men meet with their wives and no pregnancy happens. It's just like you're going to do an IVF when you're meeting with your wife. You're sending a sperm to go meet with an egg, and then pregnancy
It
doesn't
doesn't
happen.
happen.
They just continue their lifestyle. Nothing spoiled. But if it is IVF, everybody is tensed. Today is my pregnancy test. Should I not do it? Should I go to the husband to see with should I go with my husband to the hospital? And the doctor is also worried. What is the outcome going to be? Because here you've invested so much funds. And
Yeah.
so you're careful about the outcome. But in the other end, nothing is
It's just
invested.
manual labor.
Just just manual labor. Yes, manual labor. And so if it doesn't work, it doesn't work. You try the next month. So the anxiety should be controlled. It's okay to have, because you're spending so much money, but it's good to discuss with the team, because sometimes there are real reasons for anxiety. I also get anxious when I analyze my clients. For instance, a woman has a lot of scars in the uterine cavity, irrespective of the number of hysteroscopies that were done. I know what the womb looks like, and then I'm going to drop an embryo into the uterine cavity that has been treated over and over. Maybe had polypectomy, had myomectomy, had adhesiolysis. I know that the uterine lining is scarred, and I'm scarred, has adhesions. I'm going to be putting an embryos inside. No matter how you work on this uterine cavity, it's not going to be perfect. So I'm also anxious. Is this going to work? What chances do we have here? So we discuss with the client and talk about her chances and the problems
That may
that may
arise.
arise, and the chances of success. You know, so when you hang the expectation in the right places, the anxiety gets reduced. So you need to talk to the patient based on their peculiarity. For instance, somebody wants to do an IVF with her egg at the age of 44. I know the chances of succeeding is low. So we have to negotiate. We have to talk, because it's not about doing the IVF. I treat you, and I'm also going to explain to you when it
It may
works
work.
and when it doesn't work, because I'm still part of you anyways. So if you make good choices, we're okay with it. But if you make poor choices, we talk about the poor choices and the chances of succeeding with the poor choices. And when we talk about it, if it doesn't work, fine.
But at
You
least you've
understood it.
understood
You
it.
understood the reasons why probably it wouldn't work, and then you try again. You may try the same option, or you go for a better option. So that's real with IVF. Anxieties are very, and some guys go, "Hey doc, please do your best." No, you don't need to say that. We're always doing our best. We don't choose to treat one patient or one client better than the other
Another.
clients. We just give the best, and we work with only the product that we got from your body. Your partner's sperms and the partner's oocytes or eggs. And so whatever comes out of it, we're fine. We just make sure that we put the body, the uterine cavity, and the hormones around it at that point in time at the right level and perspective they need to be.
All right. So someone
There's
is
no manual labor.
so someone is asking if one has had multiple failed results, can anything be done differently to achieve a
Oh, sure.
positive result?
She needs to be seen by the doctor, take a look at the procedure all over again, and find out where things were not
Went
balanced,
wrong.
or where it went wrong, or what is, that could have been responsible for that. If the sperms are poor, you don't expect an excellent outcome. If the eggs are poor, you don't expect excellent outcome. If the endometrium is
It's
poor,
poor.
you don't expect excellent outcome. So these are all the things. But a woman who has like 10% chance for succeeding using her eggs at the age of 40, 44, expect the result of a 27-year-old girl who has about 60 to 70% chance of success. It doesn't work that way. So they need to have the proper expectation. And that is why I think the doctors and the team caring for them should take time to talk with them and put their expectations in the right position. For instance, I talk with clients, a lot of religious clients. I say, Madam, your chances is about 10 to 15%. And they say that, no, that's not my chance, not my portion. I say, whose portion is it? Is it
God
my
forbid.
body? God forbid. I say, no, God can't forbid, because this is your body. This is the nature. You can't demand of your body what it
What it
cannot
does
do
not
at
have.
certain time. So it's like having an abnormal like expectation. You know, so we will talk until you have the right expectations, because it's going to be a problem dealing with such kind of individuals. So okay, say for me it's 100%. I say, well, even if it's the angels of God at your age, their percentage is not 100%. It has to be subject to nature. So those are the things. So the expectations need to be in the right place,
Well, so please, I hope we all learned
and
something
they should make
from.
right choices,
Yes, please make right choices because a lot of people can be
right decision.
sentimental, can be very sentimental, but
Yeah.
it's their life. You can only do what.
And what intrigued me the most is that they know that the eggs are qualities are poor at certain age, and now they use the eggs at those age, and then they fail. They now come sit with you, the doctor. Doctor, what went wrong? Look, I say, I wish I'm not the doctor here now. Nothing went wrong. You need to
Um,
understand that these things are natural, and the outcome is subject to nature, you know. And so, what went wrong is your choices. Choices was wrong. And at that point, if counseling was done properly, if they heed the counsel, then everybody understands easily.
so I hope we all learned something today. And of course, you can reach out to us. We will always give you proper counseling. We will ensure that you make the right choices as it regards your fertility treatment. So thank you once again, Dr. Ken, for being with
My
us.
pleasure.
Thank you so much for your time. So thank you all our viewers for staying with us. Please do well to like our posts, do well to follow our social media on both Instagram, Facebook, as well as our YouTube channel. Also, please do well to book an online consultation if you require one. If you so desire one, we can give you an online consultation and you can also visit us here in the citrus. Thank you so much for your time. Have a blessed day.